Hello, good evening. Are you able to see me? Hi everybody. Are you able to see me? I just want to know if you're able to see me. Okay. चलो. Okay. So, how are you guys? Good evening, good evening, good evening. Thank you, Jadav Rahul. Rahul is a very good guy. Okay, so firstly, I wanted to inform you that we will be making sure to add the PYQ by tonight, the updated one where there are issues. Okay, you said many people said that there were mistakes, and yeah, I know that there are some few mistakes in that, but we'll make sure to remove them. Okay, so yeah, that's happening, Rahul. From today onwards at 10:30, you will get PYQs 25, 30 MCQs every day at 10:30 on the app. We will have a quiz on the app. Is that okay with you guys? Is that okay? This is my Ritesh Raja. He's the one who makes questions, and we have decided this together to give you MCQs till the day of your exam. Every day on integrated learning, we will be sending at 10:30 at every day 10:30 p.m. Okay, live on IL app. Okay, IL app. We will make sure to help you as much as we can. All right. Plus, हाँ, बीमार हो गई हूँ. किसको कैसे पता चला? देखो, मेरा ये प्रॉब्लम है कि मैं कभी ठीक नहीं रह सकती ना. मुझे कुछ ना कुछ होता रहता है. Hello. And the other thing that we will do is the PYQ book that we gave you. We will send the updated without the mistakes. We have corrected it together, and we will send it to you by, let's see, maybe today. Okay, whenever possible, we will finish it by today so that you don't waste any time. All right? Is that okay? Is that okay? चलेगा? आप खुश हो उससे? ठीक है? हाँ, हमारे राजा भाई हैं. Good evening. So, all right? Okay, very good. So these are the two things that we are going to take very seriously. Plus you have your mock test. You have your, what do you have? You have your mock test. Okay, your mock test. Mock test is there. When do you have your mock test? On 3rd. At 3rd, the first part, and 5th, the second part. Okay? Okay? चलेगा? ऑनलाइन ही अपलोड होगा. PYQ ऑनलाइन अपलोड होगा. ये PYQ का है. There are 3 things that we wanted to inform you. Firstly, we will be making sure to give you this thing, the PYQ updated by tonight. The second thing that we'll do is we will be making sure to give PYQs subject wise on app at 10:30. Okay, and the next thing that we'll do is mock test. All right, mock test. So let's start. Can we start? Do you want one more image based mock test? We can put one image based mock test on 8th of December. 8th of December, one image based mock test. All right? Done. And we will finish all the tests with this. ठीक है? Very good, very good. So please, today is 1st December. We are just ending the year. Let's do it on a good tone. Don't stop studying. Let's finish this year properly. Okay, 10 दिन बचे हुए हैं. NLC app में वही तो बोल रही हूँ ना. On IL app. See, IL app is a free app. NLC app, definitely whatever is on IL app will be on NLC app. Okay, so don't worry. On IL and NLC app. Okay, anybody who has IL app, no need to take NLC. All right, शुरू करते हैं. चलो 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 अब शुरू करते हैं. What is an intern conducting delivery observes mother developing breathlessness, hypotension, tachycardia, and she's collapsing. Shock is out of proportion to bleeding. What is the cause? Guys, answer quick. We will finish 3 subjects today. Class plus, there will be okay, honestly, see what, look at this. Okay, C is amniotic fluid embolism, and that happens very suddenly, plus this kind of history, right, where they gave an intern conducting delivery. Usually the most common cause of your hemorrhagic shock to agar, the most common cause of uterine inversion is due to retained placenta or due to adhered placenta, sudden removal of the adhered placenta. So this usually with interns, they don't know much about OB-GYN. Okay, they are new to the system and they have this thing where they pull the cord very fast. So the answer, and all the features are seen in your uterine inversion. Okay, look at the features. The mother is developing breathlessness. She is developing hypotension, tachycardia, and she's collapsing. She must be having neurogenic shock plus hemorrhagic shock because of the pain, the neurogenic shock, and the hemorrhagic shock because of the bleeding. So this is, the answer to this is uterine inversion. Okay, the answer to this is uterine inversion. Amniotic fluid embolism also presents with the same features, but the same features will be given. But remember that the intern delivering, right? The intern delivering, it really points out to them pulling out the cord abruptly. Okay, so they have the same features, even amniotic fluid embolism. All right, the same things happen. Got it? Let's go to the next questions. Thank you. Ritesh is very good. Ritesh, look at this. Your MCQs are awesome. Okay, pelvic associated with persistent occipito-posterior position. Can you tell about this? Yeah, that's what I said. Sudden pulling or forceful pulling. You know what we have to do when we do a delivery, right? We have to wait for the placenta to come out. There is a sudden blood. Suddenly the blood will come out by itself. तो क्या होता है जब placenta loose हो जाता है, पर interns they don't know. This comes with experience. When you do that, when you're doing cord traction, this comes with experience. You come to know when the placenta is getting loose by experience. Interns are not experienced. तो उस वजह से this can be uterine inversion. Yeah, it is very common. Even with me, when I was an intern in OB-GYN, even with me this had happened. Not uterine inversion, but I got scolded badly because I was pulling the cord too harshly. Okay, so this is very common with interns especially. Okay, what about this? Very good. The answer to this is anthropoid. Remember, the answer to this is anthropoid pelvis. Okay, the problem with anthropoid pelvis is, can you see how it is like this? And if we put a fetus's head here, are you able to rotate it properly? if the fetus's head is here, it will not be able to rotate at all. Got it? We need to do a delivery with occipital anterior position, right? And the position is completely, so what will be the management here? What will be the management here? Yes, Arshad, we are missing you too. Okay, what would be the management here? You will have to do you would have to do CS here, right? CS. All right. Okay. Look at this. A 28-year-old female presents with 46 XXY karyotyping, absent uterus and vagina. She has normal secondary sexual characters. Ovaries present, LH-FSH normal limits. What is the diagnosis? Why is it A? Why is it A? Mainly because, why is it A? Because how does your uterus develops? Uterus develops because of your Mullerian ducts. Okay, Mullerian ducts, right? Mullerian ducts. So anything related to Mullerian ducts, there should be some part of, like the outer part of vagina should be present, right? In this, right? So this is definitely Mullerian agenesis. Okay, Mullerian agenesis. The explanation of this is very important. Please make sure to go through this. We will not discuss much about it, but you will have to go through it. This is a very, very important topic. Every year from primary amenorrhea, at least 2 questions come. So make sure you go through primary amenorrhea and all that is caused because of that. Thank you, Avinash. Thank you so much, Avinash. Gautam, I remember you very well. He's my batchmate. Thank you so much, Avinash. Okay, so tell me about the 4th question, the answer to the 4th question. A patient presented with 3 months amenorrhea after abortion. Screen is blurring. Don't move. Is it still blurring? Okay. So what happened here? There is a history of amenorrhea. There is a history of amenorrhea after abortion, and serum FSH level are 61 6 units. Okay, it's 6 international unit. What is the most likely cause of this? What is the most likely cause of this? Huh?
D mark.
Kya?
D.
Can you tell the answer to us? What is the answer? What is the answer?
For Sehan syndrome. For Sehan syndrome, there will be a classical presentation of a woman presenting after PPH. Their Sehan syndrome mostly occurs due to the infarction of the anterior pituitary, and in case it will be mentioned of the amenorrhea and lactation failure, and FSH of the patient will also be low. In any case of premature ovarian failure, the woman mostly will be presenting, and the case will tell you that FSH level is more than or equal to 40 international unit. Asherman syndrome will give a history of multiple dilation and instrumentation history. Basically, it is like dilation, DNC history, curettage and everything. And for fresh pregnancy,
So mark the answer. What is the right answer?
6 international. D.
So the answer is D, Asherman syndrome. Okay, the answer is Asherman syndrome. Now let's go to the next question. A 16-year-old girl presents with primary amenorrhea. She has well-developed secondary sexual characters. On examination, there is a bluish bulging membrane. What can be the answer for this? What can be the answer for this? Again, they asked you the management, the best management for this. Can you tell me the diagnosis? The diagnosis for this? Can you tell me the diagnosis for this? Diagnosis is imperforate hymen. Imperforate hymen. This female is definitely menstruating, but the menstrual blood is not coming out. So what happens due to that? Due to that, you have what happens? There is a bluish bulge due to that. And what can you do? You can make an incision and let the blood come out. Okay? And then she'll have normal perforation. So the answer to this is cruciate incision and drainage of the blood. That is left. Alright? That is left. What about sixth? A 55-year-old female was found to have cervical cancer. Figo stage 3B. What is the management? What is the management? Cervical cancer, again, very, very important for your exam. तो आपको cancers बहुत अच्छे से करने हैं. Okay, and the management of it has been asked. Usually, we never did the management of cervical cancer that much. पर अब management भी पढ़ लो अच्छे से. ठीक है? तो बता दो. The screen is blurred. एक बार मुझे तो अच्छी से दिख रही है. There's a problem with your screen. I think your net. Because I can see the screen properly here. ठीक है? तो okay, so remember, whenever a cancer has crossed the stage of 2B in cervical to 4th, we do not do surgery anymore. We do not do surgery anymore. Remember this is a very important point. अगर हम लोग क्या करते हैं 2B stage cross कर लेते हैं, from 2B to 4th stage, we do chemo radiation. Okay, we do chemo radiation. We don't do surgery anymore. So the answer to this should be concurrent chemo Alright? Got it? And since all this, see, this you can remove by, if you know the staging, you can remove this. Alright? Got it? So the answer to this is concurrent chemoradiation. We have given the staging of the cancer. What we'll do is, since we are updating this PDF, do you want us to add the staging plus the management? The staging plus management? Can I do that for you guys? Okay? I'll make sure that the explanations are well in this. Alright? That it will help you. Okay? So that from that question itself, you learn the staging and the management towards it. Okay? Also, remember your cervical cancer has dysplasia also, right? It has dysplasia. So there is a classification based on CIN, which is your cervical intraepithelial neoplasia. There is a classification based on CIN also. And that also is divided into LSIL and HSIL. Low grade squamous intralesional epithelium, right? So I'll do that. Don't study anything that is not required. That's why whatever we do not find important, we are not discussing it. So that we can see, today is 1st December, right? And I promised you that I would finish the PDF. We have 9 days left. So I need to make sure that we go fast. Okay? Let's go to the next question. A couple presented with infertility. What I will do is, I will give you the PDF with annotations and extra points. You go through the extra points. If you have doubts, you message me on Insta. Okay, Insta, you message me on Dr. Sara 2731, or you message me on Telegram @ Dr. Sara NLC. Okay? You can message me and I will make sure to clear your doubt. Okay? Now look at this. A couple presented with infertility Woman complains of menorrhagia. Semen analysis is normal. On SHG, there is a distal block. Remember, distal block means that this must be mostly hydrosalpinx. Okay, this must be mostly hydrosalpinx. The most common cause of where most commonly hydrosalpinx is seen is in PID, and one form of PID is your salpingitis. Okay, so the answer to this is salpingitis. Okay, the answer to this is salpingitis. The answer to this is salpingitis. Tubal spasm happens, the physiological spasm is the most common cause of tubal block. Okay, and that is, your tubal spasm happens in the cornua of the fallopian tube. Okay, cornua of the fallopian tube. So that's why we are talking about the distal block here. So that is hydrosalpinx. All right, let's go to the next question. A woman with history of previous CS presented with prolonged labor. Patient is hypertensive and FHR is not audible. Fetal parts are easily palpable. Okay, patient is hypertensive, FHR is not audible, fetal parts are easily palpable on abdominal examination. What is the answer? What is the answer? Why uterine rupture? Why uterine rupture? Why uterine rupture? Very good, very good. The parts are palpable. There is a history of prolonged labor plus hypotensive, and FHR is not audible. All right. All this happens in uterine rupture. These are all clinical features of your uterine rupture. Okay. 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 Any doubts regarding this? Any doubts regarding this? This also, the presentation is also where this kind of presentation, this kind of in abruption, this kind of presentation is also there. Very good. Multigravida. Very good. Multigravida. Main thing here is that there is a history of previous CS. Okay. There is a history of previous CS. That is the most important thing here. Okay. Yes, the history of previous CS. That is the most important thing here. Whenever there is a history of previous CS and they give you any clinical features, close your eyes and mark uterine rupture. All right. Yeah. Scar rupture, uterine rupture. People, remember, Ritesh is a very, very, very important part of NLC. Have some respect for people who give you free content. Okay. Just have a little bit of respect for people who work day and night for you. Okay. Then a G2 P2 woman presents with heavy bleeding per vaginum. She has a history of few weeks of spotting and bleeding per vaginum for 3 months. She also gives a history of DNC at some normal hospital but still continues to bleed. What could be the reason? The history of DNC is very important here. Can you tell me the answer? Can you tell me the answer? Can you tell me the answer? Ritesh? Okay. So, the answer to this is retained placenta. The answer to this is retained placenta. Remember that they are talking about heavy bleeding per vaginum. That means there is hemorrhage, history of few weeks of spotting and bleeding per vaginum for 3 months, and history of DNC. Whenever there is a history of DNC, there must be some tissue that is left over. And because of the tissue, because of the retained placenta, the uterus has not properly, what has happened here? The uterus has not properly contracted, and there must be uterine. So, and there is spotting and bleeding because the uterus is not contracted properly because of the retained placenta. All right? Yeah, very good, Vishal, very good. All right, so read the explanation. This is a very good explanation. Okay, now look at this. Look at the next question. What is a complication associated with IV bolus of oxytocin? What is the complication associated with bolus IV? But we have a history here of DNC. There is a history of DNC. DIC, what is the presentation of DIC? The female will be bleeding everywhere. The female will be bleeding from all parts. Okay, she will have, what is the presentation there? The platelets will be low, clotting factors are all exhausted. Okay, DIC is a very emergency situation, and it has a very high mortality. All right, nothing else makes sense except, yes, very good. Okay, look at 10th. Remember, it will cause hypotension and tachycardia. It will cause hypotension and tachycardia, and the answer to this is hypotension. Okay, the answer to this is hypotension. The answer to this is hypotension. Why is it not option 4? Guys, understand that they have a history of DNC. It is a very common thing that happens, that placenta, because of placenta remaining, there can be spotting and bleeding per vaginum since the uterus has not contracted properly. Okay, so no problem, nuclear briefcase. And look at the 11th question. Look at the 11th question. This is your 11th question, and they have asked what is the following, which of the following is the peak is responsible for ovulation. Okay, which of the following peak is responsible for ovulation? So I've changed the image for this. Okay, so please tell me, is it A, B, C, D? So what is A representing? Can you tell me what A is representing in this diagram? In this diagram, what is A representing? What is A representing here? A is representing LH surge. Very good. LH surge. What about B, C, D? Can you tell me something about it? Again, very, very important. Tell me 32 to 36 hours. What is the significance of 32 to 36 hours, and what is the significance of 10 to 12 hours? Can you tell me the significance of both of these? You tell the significance and we will move to the next question till then. Okay, a 23-year-old preemie gravida presents to her physician at 18 weeks with FBS of more than 126, HB1AC of more than 6.5. So what is this? This is a very simple question. Very good. LH search 36 hours before ovulation. And after that, yes. Very good. Very good. Now tell me about this. What is the answer to this? What is the criteria for gestational diabetes? What is the criteria for gestational diabetes? This is gestational diabetes. And the criteria is FBS should be more than FBS should be more than 5.65 is normal, right? It should be more than FBS should be more than 120. Okay, more than 120. Your HB1AC should be more than 6.5 and very good. Yeah. Okay. So the criteria and your DM in any kind is very important. Remember Ashish sir did DM in medicine. He teaches it very well. If you have any queries, please go through the rapid revision of medicine, especially the diabetes part. Even I learned it from him and it has made it very easy for me. All right. So the answer to this is, see, I'll tell you one thing. This was not given as 18. Okay. I'm changing this. They will never ask you about pre-gestational diabetes. They will ask you about diabetes. The gestational and the which other type of diabetes is important in pregnancy? Which other part of diabetes is important in pregnancy? If I change 18 to 24, what will you tell me? If I change, yes, overt and gestational. Okay, they will not ask you about pre-gestational diabetes. They will mostly ask you about gestational. And the question, the answer for the question that was given for the exam had gestational diabetes as the answer. Okay, so I am going to change this question to 24 weeks. Okay, 24 weeks. Now tell me, if the patient comes at 24 weeks, what will be the answer? What will be the answer if the patient comes for 24 weeks? Right now, 10 days before the exam, I want you to study about gestational diabetes, plus I want you to study about overt diabetes. Very, very important. These two you study properly. Okay? Yes, so the answer becomes gestational diabetes. All the corrections will be made today. Okay? And I will give it to you ASAP. Now tell me about this. Tell me about this false statement regarding this. False statement regarding this instrument. Firstly, what is this instrument? नहीं है. 6.5 equal to or more than 6.5 is diabetes. Equal to or more than. ठीक है? Now tell me about this. ये क्या है? पहले तो ये है क्या? They asked it in NEET PG also. What is this? This is your vacuum. Very good. This is your manual vacuum aspiration. And the capacity is not 30, it is 60 ml. Okay? The capacity is 60 ml. Everything else is done. Where is this used? Where is this used? Just tell me, where is it used? Important. Where is this used? This is used for mainly abortions. Okay? Where we have to remove the tissues. Alright? So MTP, yeah, MTP. Okay? Got it? There it is used. Okay? Remember this properly. Now, what about this? A 24-year-old primigravida attends ANC clinic with BP 160, 120. Her lab findings show increased liver enzyme. Again, this is a very easy question. BP has been increased liver enzyme, increased LDH, low platelet. This is definitely the whole question itself is pointing towards HELP syndrome. Okay? The question itself is pointing towards the definition of HELP. Can you just tell me how do you open HELP? Can you just tell me HELLP? How do you open it? It's 60 ml. Very good, very good. See, the explanation here is given and it's very good. Okay, remember it is seen in the 3rd trimester. Very, very important. And the clinical feature would be the female would have abdominal pain. And these are the values that are increased. Just go through the values. Mostly they will themselves tell you that the values have increased. All right? All right. I just wrote down the values in case you want to know what are the normal values and when it becomes abnormal. All right? ठीक है. तो go through the values. ठीक है? And now look at this. A 25-year-old preemie known case of bipolar disorder is on lithium since 2 years. What is the most common anomaly seen? See, lithium is contraindicated in pregnancy. Why? It is contraindicated in pregnancy. Why? Because it causes Epstein's anomaly. Okay, this is a direct one-liner. Nothing much to learn here. And Epstein's, okay, direct one-liner. Epstein's anomaly. And you should know the category of drugs. The category of drugs which are... Can I make a table and send you the category of drugs which are... They once asked a question about category A, B, you know, they asked you about the category X also. So make sure you learn about the drugs in the categories. Okay? So I'll put it in this PDF of PYQs. Okay? I'll put the categories of drugs. Okay? Very good. X is your 100% teratogenic phase. Alright. So you go through them. A pregnant woman with prostatic heart valves on warfarin test positive for pregnancy. Again, this question is again relating to what? The categories of drugs that we should not give in pregnancy, or depending on the category which drugs we can give. So since 2 questions have come regarding this, should you not learn about the categories of drug? Can you see the importance of this in the exam? So you replace it with heparin because it is better. Alright? And remember, warfarin is a teratogenic drug. It is a category. Which category? It is a category. It is a category that would be your homework. Okay? Now look at the 17th question. A pregnant woman comes for checkup at 18 weeks. On examination, uterus corresponds to 16 weeks and USG shows oligohydromnias. Which of the following is the likely cause? Very good guys. I'm so proud of you. Seeing you answer such question just makes me happy because OB-GYN, PSM, surgery are the subjects that give you 100 marks. तो अगर आप ये 3 सब्जेक्ट बहुत अच्छे से कर लिए तो then you just have to study for 50 more marks. Okay? So what will happen? You will pass. Okay? You will pass. And that is the best thing that can happen. Okay. So uterus corresponds to 16 weeks and so the uterus is smaller and USG shows oligohydromnios. What is the most common cause of oligohydromnios? Again, this is a very one-liner wala question. And in syphilis, again, it is an NTDs. NTDs will cause polyhydramnios. Okay? And I wrote down the causes of your oligohydramnios: renal agenesis, post-urethral valve, endomethacin, postpartum, rupture. No, pre-rupture of membranes. Alright? So all these are your causes. And congenital malformations is one of the major causes of your oligohydramnios. Okay? So B is actually the answer to this, and anencephaly shows oligohydramnios. Now look at this question. This question has become a very controversial question, right? Because so many people have given different answers for this. So tell me, what is the answer to this? VIA या pap smear? See, basically remember that they asked you regarding the most cost effective and cheap. The most cost effective and cheap. Okay, so that is your VIA. That is your VIA. If they ask you what is most commonly used, what is most commonly used for screening, what will you put? What will you put? Yes, pap smear. Most commonly used for screening is pap smear. Okay, so the most cost effective is your VIA. अगर पूछा गया कि most commonly used या only screening that you would prefer या best screening, anything you put pap smear. Anything else you would always choose pap smear. ठीक है? तो let's not keep any controversy in this. The question is very simple. It is a cheap cervical screening test. All right? Yeah, and it is cost effective. अगर पूछा मोस्ट कॉमन तो डालना पैप स्मीयर, अगर पूछा कॉस्ट इफेक्टिव तो डालना VIA. ओके, नाउ look at this. I wrote over here most commonly is used pap smear, and these are your PYQs as well. What is the spatula? This is your Ayer's spatula, and which zone is used in the Ayer's spatula? Which zone is used? And this is your cyto brush. And which zone is used in the cyto brush? Which zone do we use the cyto brush on? It is used on the endocervix. This is used in the transformation या transitional zone. ठीक है? Okay, come on. Identify this. See, any other app test. See, remember you're giving an FMG exam. Most of the question in major apps are for NEET, INICET, AIMS. So when they make mocks, they just do a permutation combination. Nobody personally makes the mocks. Okay, they do a permutation combination and they put 7. For biochem, you need 17 questions. So they just select 17 questions and they put it there. So like that, the mocks are made. Is that beneficial to you, or is it really showing you whether, is it effective or not? So my biggest ajizi, my biggest request to you is do not give any app test, any app mock test. It will just depress you, because even I did not pass those tests, but I am sitting right in front of you and I cleared the exam, and he cleared the exam as well. And don't give those app mock tests and get depressed. There is no use. It really shocked me when I remember crying during that time, because I was like very confident, and then I gave the mock and I scored 120, I guess. I scored 120 or 121. And it really scared me. I was like, how will I give the exam? So don't depend on those mock tests. Don't depend on those mock tests. Yeah, don't depend on those mock tests. If you get 60, 70 in that mock test also, you can get 150 in FMG exam. I am truthfully, honestly telling you. Okay, honestly, I am telling you this. So don't worry. आप मेरे ऊपर छोड़ दो. मैंने आपसे वादा किया है ना. There will be 2 mock tests. Okay, somebody wanted part A, part B. So what we'll do is, do you want me to keep it in the morning? 10:30 your exam will happen in the morning, and 2:30 your exam, the other part happens. So do you want me to keep it like that in one day? Do you want me to keep it like that? आपको ऐसा रखना है क्या? Okay, so what I will do is on 3rd, your first mock test will be at 10:30 and the next mock test will be at 2:30 p.m. Okay, so it will give you the real feeling of the exam, and image-based mock test will be on 8th. Okay, ठीक है. So don't worry, leave it to us. I also told you that I will make sure from today onwards at 10:30 p.m. we will have MCQs, 30 MCQs on IL and NLC app. every day till your exam, subject wise. Okay, PYQs will be there and they will definitely benefit you. So do not worry about the MCQs, do not worry about the mock test. Please do not give app mock test. It will only depress you. I beg you, okay? Because I know the truthfulness in that, okay? Yeah, class plus app. Okay, let's go to the next question. This is your Bartholin cyst. Can you tell me the management of Bartholin cyst? Can you tell me the management of Eddie? Thank you so much. Can you tell me the... Yeah, okay, Dr. Atif. Let me consider the timing of the mock test. I will tell you the timing. Actually, I wanted to keep it at 5 p.m. because then everybody gives the exam. And I don't want you to give 2 exams in one day. See, even in the real exam, you give 150 marks once, then you give 150 marks another time. You don't give 300 marks together. Okay, that is a misconception. You know, in the beginning of the mocks, there should be part A and B. Nobody should give you a 300 mock test. You will never be, you don't need that much stamina for 300 mock tests, 300 questions at one time. Even in the exam, in the real exam, you do 150 questions first, then you do 150 questions again, and you get a break in between. So that I don't understand how anybody can make a mock test of 300 marks. That's just stupidity. Okay? There should be part A and B. I will do part A and B, okay? So this is your Bartholin cyst, and tell me, yes, the treatment is marsupialization, okay? Marsupialization. The treatment is marsupialization. What do? You put an incision and then you open it and stitch it around, okay? Take this part and stitch it around so that it can freely drain. The cystic, that can freely drain. All right? Okay? Let's go to the next question. Again, this question has been asked at least 4-5 times. Okay? And then, a 26-year-old gravida who presents with history of 3 previous mid-trimester abortions, presents at 22 weeks with cervical length of 15 mm. What could be the possible cause of miscarriage? Study solution. See, why will you build a stamina for 300 questions? You build stamina to do... See, you build the stamina according to your paper. If your paper comes directly for 300 marks, then that is a different thing. In NEET PG also, now they have made 200 marks. For your exam, you have part A and B. You don't give 300 at one time at any point. So you practice with 150 and practice according to the subjects. That is more beneficial than practicing 300 together. Okay? Because you will get exhausted. You will get exhausted. I'm telling from experience. Okay? Okay? Why is this cervical incompetence? I'll tell you one thing. What happened here is there must be recurrent abortion. The most common cause of recurrent abortions is your uterine anomalies. Okay, most common cause of recurrent abortions is your uterine anomalies. But what happened in this question? In your uterine anomalies, you have malformations like your septate uterus, your uterine diadelphys, all these malformation, and the most common malformation due to which it happens is septate. Okay? Then it also includes your fibroid, submucous fibroid, and cervical incompetence. मतलब shortening हो जाती है cervix की, and the cervix can dilate and the delivery can happen faster than expected. So here they gave the cervical length as 15 mm. Is that normal length? That is pointing towards cervical incompetence, right? That is pointing towards cervical incompetence. Very good, very good. In mid-trimester, it should be 25. It should be 25. It should be 25. See, if you're not able to score more, Okay, don't worry. So now you know. Yeah, now you know. So this question I wanted to do properly. I don't want you to get confused with it. आप ये question देख लेना. इसमें what is the most common cause of your recurrent abortions? It is uterine anomaly. What does uterine anomaly include? Abortion, malformation, fibroids. It includes malformation, fibroid, and cervical incompetence. Here the cervical length is short. It should be 25, but it is 15. So this is definitely your cervical incompetence. समझ गए? समझ गए? समझ गए? समझ गए आप लोग? The question is that the question basically tells you that there are mid-trimester recurrent abortions in this female. So what are they asking you is, why is the recurrent abortions happening? So they are asking you the cause of that. The most common cause of recurrent abortions is uterine anomaly. Uterine anomaly में आपके inclusions क्या है? Your uterine malformation, मतलब congenital problems in uterus. Congenital problems क्या है? Due to Mullerian ducts आपके क्या होते हैं? Septate uterus बन जाता है. The uterine didelphys, unicornuate, bicornuate, and the most common in that itself is septate. Okay. Remember, fibroid also cause recurrent abortions, and the most common to cause that is submucous, and you have cervical incompetency as the option also. समझ गए? समझ गए? समझ गए? I will include that in the updated PDF. ठीक है? Now look at this. Look at the next question. A 25-year-old woman visits labor room at 37 weeks. Patient with mid-labor pain for 10 hours, and cervix is persistently dilated for 4 centimeters. What is the management? And Ritesh will be doing this. Ritesh doesn't speak much, but I am trying to involve him into this because he is very good with questions.
Explanation.
Okay, great. I'm glad you know that. हाँ, explanation यहाँ पर है. Okay.
Patient in mid-labor.
Yeah, speak louder.
Patient in mid-labor pain, 10 hours and persistently 4 centimeter dilated. In this,
Louder.
up to up to 5 centimeter cervical dilatation, it is in latent phase. And for nulliparous, we have average period is 12 hours. And prolonged is more than 20 hours. In this, we have to do observation and sedation and wait.
Actually, the thing what happened here is this female has been, the cervix is persistently dilated at 4 centimeters, okay? And this is something controversial, right? 5 centimeters and 6 to 10. Just remember, this is from Williams, okay? This is from Williams about the latent phase and the active phase. And in the nulliparous woman, what do? You wait until they go into active phase. So, bro, please smile. Smile. They go into the till they go into the active phase, the only thing you can do is wait and observe sedation. Why? Sedation is also the cause for prolonged labor. Okay, sedation can be sedation or giving painkillers, right? Epidurals, they are a cause for your prolonged labor. So that's why, remember, these are the values that you should know. If it is more than 20 hours only, then there is a problem. You can wait till usually on an average it happens at 12, so you can wait till 20 hours before you do anything. So here the option is observe sedation and wait. All right. Observe sedation and wait. He is not serious, he's just not used to talking to people. Okay, he doesn't like interacting much, na? Most common cause of DIC in OB. What is the most common cause of DIC in OB? Most common cause of DIC. DIC again is a very important topic for your exam. And remember the clinical features will have bleeding. Yes, very good. Primigravida or null? Yeah, primigravida means the first time somebody is having is primigravida, and right? I'm talking about nulli and multi. So if the nulliparous will get pregnant, she will be a primigravida only, right? Logical है. ठीक है? Okay, what is the most common cause? What is the most common cause? Remember that all three of these are cause, and the most common cause is abruption. Okay, most common cause is abruption. See, this time in the exam, it is scary that they gave options which are very close to each other. Intrauterine death of the fetus can also cause DIC. Okay, but the most common cause is abruption. Because why is the most common cause abruption? Because more than intrauterine fetal death, abruption happens more commonly. Okay, got it? Got it? You know the answer now? All these three are cause. So by heart the causes, maybe they didn't give the same options, but mean is abruption. Okay. Now look at the next question. Identify the mass present on the top of the uterus. Okay. So definitely this is pointing towards your fibroid, and the fibroid that is on the top is a pedunculated subserous fibroid. Both of these are subserous. What about this? If this was pointed, what would you call it? If this was the point, what would you call it? Again, fibroid, very important for your exam. Yeah, what is this? Tell me, what is this? What is this? What about this? What about this? Tell me this. This is also a pedunculated polyp. You tell me about this. I will send a picture of, I'll put a picture of fibroids here. Okay, I would put a picture of fibroids here so that you can know which one is what. Okay, now in the updated, I will put the picture of fibroid here, all the kind of fibroids. And tell me, where is red generation happening? Red generation in fibroid. Red generation in fibroid. One thing that you should remember is that your fibroid has a capsule, okay? Your capsule, there was another question about leiomyoma, right? Leiomyoma is nothing but a fibroid. So the capsule is called pseudocapsule and it has blood vessels. But your center of the fibroid does not have blood vessels. So it gets infarcted, and that's where your red generation is seen. Red generation most commonly presents in the second trimester in pregnancy. Okay, all these questions have been asked. All right, so learn about this. Let's go to the next question. Which of the following has false positive bar body? Which of the following has false positive bar bodies? So the answer to this is Klinefelter syndrome. Okay, this is Klinefelter syndrome. What is the karyotyping? Can you tell me the karyotyping? It is 47XXY. Okay. Also remember, gynecomastia is there. Gynecomastia is there. And what happens? What else is there? Long limbs. Okay, long limbs. These are clinical features that you should remember. Marfan syndrome, very, very, very important. Remember, there is subluxation of lens in this. Subluxation of lens in this. The most common eye problem. There is subluxation of length seen in Marfan syndrome. Then there was a question about a painless growth for 2 years, which looks cauliflower-like. Cauliflower-like. What is the diagnosis? Cauliflower-like growth. Cauliflower-like growth. Can you tell me the answer? I will update these questions, okay? I'll update these questions. Very good, Tejendra. Very good, Ria. Condyloma acuminata. Very good. Condyloma. If they say cauliflower, like close your eyes. And what is condyloma lata? Can you tell me the meaning of lata? Condyloma lata. Condyloma lata. Condyloma lata. That is seen in your syphilis, right? Secondary syphilis. Okay. And remember, they do not look like this. Okay. And remember, what HPV causes? These are all PYQs. All these have been asked. And cervical cancer, can you tell me which one is the most specific? Most specific in cervical cancer? Which one is the most specific? Most specific, that is your 18. Okay, 18 is the most specific. 18 is the most specific. Most common is 16. 18 is the most specific. Now look at this picture. A postmenopausal asymptomatic woman with the following image. What must this be? What must this be? Okay, I'll show you. This is a calcified fibroid. There was another question asked, which is the most common fibroid to undergo calcification? Which is the most common fibroid to undergo calcification? Okay, and what doesn't make sense here is that she's postmenopausal. Okay, so they must have given you to confuse you, because usually this fibroid condition happens it is an estrogenic this thing, right? It is estrogen dependent. Very good, Soha. It is your subserous fibroid. Subserous fibroid. Remember the other names for your fibroid. It is also known as womb stone. And can you see that it has popcorn calcification? Can you tell about popcorn calcification? Popcorn appearance, popcorn calcification. Where else is this seen? Popcorn appearance. Where else can you tell me where else is it seen? Where else is it seen? Very good. Fibroadenoma. And on what kind of diagnostic modality? On what kind of diagnostic modality? Hamartoma. Very good, very good. On hamartoma, on what kind of diagnostic modality? Carcinoma. Fibroadenoma is not a cancer, it is a benign tumor. Okay, and fibroadenoma usually presents in a 20-21-year-old female, a young female. Okay, a young female. The presentation itself will include a young female. A young female. Fibroadenoma. Plus on mammography, it is seen. The popcorn calcification is seen. Okay, so this is very, very important, your popcorn calcification. All right. Then look at this. They asked a female after delivering complaints of cramps during breastfeeding. Which hormone is responsible for milk ejection? Can you tell me which hormone is responsible for milk ejection? The pain happened due to milk ejection. So can you tell me which hormone? Can you also tell me what prolactin does? What is the role of prolactin? Can you tell me? Very good. The answer to this is oxytocin. Now tell me about prolactin. Genesis. Very good. Genesis is done by milk production, or genesis is done by your prolactin. Very good, very good, very good. Now tell me about this. A 32-year-old female, pregnant female, complaints of 32 weeks pregnant female complaints of vaginal bleeding. On PA, per abdominal examination, uterus is tender. There are no fetal heart sounds. Okay, so tell me, what does this represent? I'll tell you the options. Okay, I rubbed the options out also. There was no option, but can you tell me what is this pointing towards? This is actually a very classical exam. Um, did they, in intrauterine death of fetus, can you tell me another thing that they ask? They ask one more thing in the clinical. They ask about one more thing. Intrauterine death, can you tell me what will they ask you? What else will they tell you? This female is coming with vaginal bleeding. Okay? This female is coming with vaginal bleeding. And examination, the uterus is tender and fetal heart sounds are absent. This is a very classical feature of abruptio placenta, especially the concealed version, the concealed type of abruptio placenta. Okay? FSH, the fetal heart sounds are not heard. Uterus is hard, tender and tensed. Okay? And there is vaginal bleeding. This is a very classical finding of abruptio placenta. Okay? And what is the management in this? Yeah, so did they give you anything about fetal parts? Did they tell you about any kind of amniotic fluid? Yeah, and of course, that Spalding sign, what signs are seen on ultrasound on intrauterine death? Your Spalding sign is seen, and the first sign to present is the Roberts sign. These are all very important signs. Okay? But the answer to this is abruptio placenta. Abruptio placenta. Now look at the next question. A mother brings her 18-year-old daughter to the OPD with complaints of not attaining menarche. Hormonal studies show normal FSH and LH. Examination shows normal breast development and pubic hair. USG shows small blind vagina and absent uterus. What is the karyotype? Again, this is very, very simple. This is definitely, this was like the same thing. This is Mullerian agenesis. Okay? This is Mullerian agenesis. There is absent uterus and the karyotyping is normal. Okay? Got it? This is Mullerian agenesis. Then, what is the next question? What is the next question? A 60-year-old hypertensive female complains of prolapse. What is the best management? What is the best management in this? What is the best management? What is the best management? She has prolapse. Look at the age of the female. She's a 60-year-old hypertensive female. In a hypertensive female, will you want to do surgery, that though she is 60 years old? Okay, I actually wrote it down here. Congenital, the sling surgery is actually done in congenital prolapse, usually in a younger female. Okay, younger nulliparous females who wants to have kids. Okay, if she wants to have kids, then we do sling surgery. For Lefort's polysis, which is the answer here, we do in more than 65 years old, especially, and this is a 60-year-old female with hypertension. There is a contraindication for surgeries in this females. Okay? And ring pessary is actually a temporary method, and we usually do it in females who are refusing for surgery. समझ गए? So no need for surgery here. You do Lifford colpolysis. All right? The answer is C. What is 31? Which of the following is the cause of lactation amenorrhea? This question, I will make it better in the updated PYQ. Okay? Let me do that and I'll add more OB-GYN questions which are important for your exam. Okay? Let's finish OB-GYN here. Okay? Let's finish OB-GYN here. समझ गए ना ज्योति? Very good, very good. And we will go to your pharma. Now look at this. Which of the following anti-diabetic drugs does not require reduction in renal failure? Reduction in renal failure. This is a very, what do you say? This is a mugging up question. It is contraindicated in renal failure. Okay? Renal failure, it is contraindicated. I'm sorry. Except for linagliptin, everything else is contraindicated in renal failure. Everything else is contraindicated in renal failure. Sorry. These are contraindicated and linagliptin can be used. Linagliptin can be given. Okay? Sorry. मुझे माफ कर दो. हाँ, everything else is contraindicated. This is given. What? Okay? And remember, these are your gliptins are what? What are they? Gliptins are what? हाँ, मैंने बता दिया ना. Linagliptins can be given. Linagliptin can be given. These cannot. They are contraindicated. Now tell me, what are they? They are your TP. What are linagliptins? And they are given in which one? Type 1 or type 2 diabetes? Type 1 or type 2? DPP4. Very good. Tell me where are they given? Type 1 or type 2? Type 1 or type 2? Very good. They are given in type 2. What is given in type 1? What is given in type 1? What is the drug of choice in type 2? What is the drug of choice in type 2? Very good. Insulin is given in type 2. Type 1. Insulin is given in type 1. Okay. And your drug of choice for type 2 is metformin. Very good. Metformin. Very good. So look at this. Look at the next question. We did it. We did this already in OB-GYN. Okay. Category X drug. What do? We change warfarin to heparin. Okay, we change warfarin to heparin. Very good. Yeah, very good. DKA also. And DKA is a common presentation of which kind of diabetes? Type 1 or type 2? DKA is a presentation of which kind of diabetes? Yes, this is changed to heparin. Type 1. Yes, that's the thing. So ultimately you will give insulin here. You will give insulin. It is a very, like looking at a DKA patient, it's very scary because it looks like they will die soon. They come in the emergency and I remember seeing such patients, they really look like they would die. Which of the following drugs used in emergency management of asthma does not act by causing bronchodilation? Now first tell me, what is your salbutamol? What is your salbutamol? What is your salbutamol? What is your salbutamol? What kind of drug is this? This is your SABA. Very good. What about your ipratropium? Ipratropium deriferylin. See, bronchial asthma is very important. and you should know which category all the drugs are belong to. Again, we have given it here, all of them. Okay, beta 2 agonist, beta 2, yeah, very good, very good, very good. So make sure you go through this, all right? And the answer to this is your hydrocortisone. It does not cause bronchodilation. It is a steroid, right? Steroid, right? It is anti-inflammatory. It is also used in other conditions of inflammation. All right? Good doctor, please message me. Please message me personally. All right? Which of the following is the action of dopamine at low dose? Again, this is important. Again, this is important. At low dose, which receptor is involved? At low dose, it stimulates what? At low dose, it stimulates what? What is the answer to this? Which of the following is the action of dopamine at low dose? Yes, very good. It stimulates D1. And D1 is very common in your renal blood vessels. That's why it causes renal vasodilation. It causes renal vasodilation. Okay? Renal vasodilation. ठीक है Anjali, I'll do that. Okay? It causes renal vasodilation. Also remember, it stimulates in the intermediate, it stimulates B1, and at high doses it stimulates A1. So it will end up causing vasoconstriction. Okay? It will end up causing vasoconstriction. What about your next question? A female patient presented to the ER with pain and redness in the grade 2. First, tell me the diagnosis. What is the diagnosis of this? She has serum acid, uric acid levels of 9.6. We gave some pain meds for the pain. But what else can decrease the formation of uric acid? Okay, very good. The gout is your diagnosis. Okay, gout is your diagnosis. And what happens? We give, what is the drug of choice that we give here? Which drug are they talking about? They are talking about allopurinol. Very good. They are talking about allopurinol, and that inhibits xanthine oxidase. Very good, very good. Vitamin that increases the absorption of iron from stomach. Just remember, your vitamin C or ascorbic acid increases iron absorption. Your tannates and what else? Your tannates, your oxalates and phytates decrease iron absorption. Okay? These, both of them are PYQs. Both of these points are PYQs. Okay? What about longest acting phosphodiesterase inhibitors among all of the drugs? Sildenafil कहाँ दिया जाता है? Sildenafil पे 2 क्वेश्चन आते हैं. Acute gout, you give NSAIDs, right? NSAIDs are given for acute gout. Very good. Erectile dysfunction. And why can you not give it with any hypertensive drug? Right? There is a question about that, right? Sildenafil with one drug will cause severe hypotension. Yeah, see, drug of choice is different. What is the first thing that you give? Now tell me, the longest acting drug here is your tadalafil. Tada! It is your tadalafil. And remember, this is a phosphodiesterase inhibitor 5. Okay? Yes, it is not combined with nitrates. Very good. It is not combined with nitrates. Very good. Very good. It is not combined with nitrates because they give severe hypotension. Very good. Very good. Whoever that is a PYQ also. Okay, that is a PYQ also. Very good. Very good, guys. Very proud of you guys. आपको सब आता है. Now tell about this. Tell about this. This graph has been asked about so many times. Which of the following statement about this drug is true? Drug A is more potent. Drug A and B have equal efficacy, but A is more potent than drug B. Drug C is least potent. Can you tell me which one defines the height and which one defines the going left? Potency on the graph is seen like this. Okay? Potency, look at this. This drug, what is the meaning of potency? Meaning of potency, if I take two drugs, at 5 mg, I am getting the same result. I am getting some result here, okay? At 5 mg, I am getting the result here of one drug A, and at 10 mg, I am getting the result of drug B. Which of this is more potent? Which of this is more potent? A here is more potent. Okay? And your A is look at A. It is giving the effect in this much time. But look at your other drugs. B is giving you the same effect in this much time. C is giving in this much time. So the more left it is, that is more potent. Okay? And the more height it is, so your C is the most efficacious and A is the most potent. Alright? And the answer to this is A. Drug A is more potent. Got it? Look at the next question. Which of the following antidepressant drugs acts by inhibiting the reuptake of both serotonin and noradrenaline? So they basically asked you an SNRI here. They basically asked you SNRI. Okay? So the answer to that is your venlafaxine. The answer to that is your venlafaxine. Alright, that is venlafaxine. Venlafaxine. Your fluoxetine is an SSRI. Fluoxetine, your SSRIs are the drug of choice for depression. Very good. Very good. Very good. They are a drug of choice for depression. Now look at the next question. A 4-year-old boy drank full bottle of iron syrup. What antidote for acute iron poisoning can be given? And another question that they can ask you is, a thalassemia patient has multiple blood transfusion. What drug of choice can you give for the increase in iron due to that? So the answer for that is desferoxamine. The answer to that is desferoxamine. Now look at this. Which of the following antimicrobial is contraindicated in a patient with seizure disorder? Basically, both are contraindicated. Which ones? Your ofloxacin and moxifloxacin. But ofloxacin is more contraindicated. It should be more avoided. All right? Basically, both should be avoided. The answer is B. But I have given these two options so that you know that both are avoided. Okay? But mostly B. There is a higher B more than C. Okay? B more than C. Yes. Now look at the next question. Which of the following drug is preferred for closure of ductus arteriosus in a preterm? Which of the following drugs? Remember that both your indomethacin and ibuprofen, first indomethacin used to be used, but they had side effects. So now we are using ibuprofen, okay? Now the ibuprofen is used for PDA as it has lesser side effects, lesser adverse or side effects, okay? So the answer is B. Look at the next question. The drug of choice for the treatment of digoxin. This digoxin-induced ventricular arrhythmia is, yes, mostly recommended is ibuprofen due to its less adverse effects. What is it? What is the drug of choice for treatment of digoxin-induced ventricular? ये तो एक direct one-liner है. This is your lignocaine. What about your atropine? When do you give atropine? What about your amiodarone? What about your procamamide? All these are very important drugs. Very good. Atropine is given in OP poisoning. It is also the drug of choice in what? Anaphylactic shock. Amiodarone, procamamide comes in your ship drugs, right? So they cause ship drugs. They are SLE causing drugs. Okay? And your amiodarone. Amiodarone. It is a longest acting potassium channel blocker. Okay, it is the longest acting potassium channel blocker. So these are very, very important. Yeah. Okay. All right. Let's go to the next question. This we have done before. Isotope for iodine used for the treatment. For the treatment is I-131 because of its half-life being 8 days. Okay. Half-life is 8 days. And for diagnosis, we use 123 because the half-life is 13 hours for that. The half-life is 13 hours. Akhilesh Sharma, good evening. Okay. I'm sorry, I'm very sick, but I don't want to stop these sessions anymore. My sickness will go, and I promise you I will be more interactive. It won't be so boring. Okay. It's just that like not sleeping, traveling, plus working day and night. I came home at 4 o'clock in the morning and I slept till 8:30, and I've been working since then, updating the PDF, adding questions. So but I know whatever work we do, right? Whatever work we do, we will ultimately be doing it for you, okay? And it will definitely help you pass, and that is the best thing that we can do for you. So till 12th comes, we will not sleep properly. एक बार 12 दिसंबर आ गया, आपका एग्जाम खत्म हो गया, तो डेफिनेटली हम बहुत अच्छे से सोएंगे, ठीक है? Don't worry, we will take care of you until then. Now look at this. A patient undergoing surgery was given halothane for general anesthesia. Again, we have done this question. Halothane is a inhalational anesthetic agent, and it causes malignant hyperthermia. And this is caused in people with a defect in ryanodin receptors. Okay, ryanodin receptors. ठीक है, समझ गए? और इसमें कौन से चैनल्स इन्वॉल्व है? कैल्शियम के, ठीक है? इसमें कौन से है? एंड द ड्रग ऑफ चॉइस इज dantrolene. The drug of choice is dantrolene. I'll do hepatitis. Don't worry, I'll do hepatitis. One day, hepatitis, TB and leprosy. We'll do that all together one day. A lady was stung by bees. Again, this is a type 1 hypersensitivity. Stung by bees, she developed breathing, she is having anaphylactic shock. And we give, I'm sorry I told atropine before, it is adrenaline or your epinephrine. And the dose itself has been asked. The dose is 1:1000. The route has been asked. These are your PYQs. IM, the root is IM, and you usually give it on the thigh. Okay, and the diagnosis, the answer for this is adrenaline. Remember, this is a type 1 hypersensitivity reaction. IgE is released, mast cells are released, and they produce histamine. Okay, all these are your PYQs. All these are your PYQs related to this question. हाँ, पहले काटा होगा. फर्स्ट टाइम एक्सपोजर होता है. फर्स्ट में एक्सपोजर होगा, दूसरे टाइम में एनाफिलेक्टिक शॉक होगा. Now look at the next question. A patient presented to the ER after an RTA. The patient has raised ICP without intracranial hematoma. Which of the following is the preferred drug of the management of this patient? Of course, there is cerebral edema and the drug should be mannitol. There can be no, this is a direct one-liner, it is mannitol. Alright, it reduces the cerebral edema. Now look at the next question. They asked about oxygen. So can you tell me which out of this is for oxygen? First tell me which is the blue one. For blue, which one does it have? Which one is there in blue? Blue. N2O is your blue. Your oxygen is white shoulders and black body. This is your oxygen. Okay, this was the answer. Then this is your, what is this? What is this? Blue body, white shoulder. Blue body, white shoulder. This is your, this is not nitrous oxide. Blue body, white shoulder. There is white shoulder in this. This is your Antonox. Antonox. Okay. Very good, Dr. Daksh. Very good. This is your Antonox. And then look at this. Look at this. What is this? This is your helium. Okay. This is your helium. Brown is your helium. Now look at this. A drug addicted patient. I'm sorry for the coughing. I don't want you to have problems. I cannot control it. Okay. I'm really sorry. Now look at this. A drug addicted patient presents with agitation and ulceration of skin. The patient had severe itching, scratch mark bodies. On examination, there is a presence of tachycardia, mydriasis, hypertension. Most likely responsible for this is this is definitely clinical features pointing towards cocaine. Okay, it is pointing towards cocaine. Remember that the ulceration happens because of snorting. The ulceration happens, you snort, right? From the nose. So ulceration, there are septal ulcerations due to that. Okay, and they also have a tactile hallucination, feeling of bugs crawling on their hands and feet, and they scratch them. That's why there is scratching present. All right, all this is seen in your cocaine, also known as crack. Cannabis is what? It is your weed. All right. Don't try also, Dr. SF. All these things are not worth trying. Okay. A patient presented with weakness of limbs, muscles, especially in evening after work. The symptoms improved after hydrophonium test. This is a very easy question. Okay. This should not make a problem. This is your myasthenia gravis. Okay, this is your myasthenia gravis. Definitely, because hydrophonium, the half-life of hydrophonium is less than 10 minutes, right? And the what happens here? What is the drug of choice? Can you tell me the drug of choice? Drug of choice? Hydrophonium test is nothing but your tensilon test. What is the drug of choice? Yes, if symptoms persist, cholinergic crisis. Very good, Anand Acharya. What about this? What about this? Physostigmine plus atropine. Don't forget atropine. Not physo, it is pyrido. Pyridostigmine or neostigmine plus your atropine. Don't forget atropine. Okay? Don't forget your atropine. Now let's go to the next question. Again, this question is about that. The same thing. Okay? and the test that we can use is edrophonium, or the drug that we can use is edrophonium here. ठीक है? Very good, very good, very good, very good. Now let's go to the next question. A man traveled to Assam. After coming back, he developed fever, chills, and rigor, and altered sensorium. The peripheral smear demonstrates the presence of P. falciparum. What is the treatment of choice for this patient? Always, okay? All right. So the answer to this is your intravenous arsenate. Remember, this is complicated malaria. Okay, complicated malaria is handled with your and falciparum, and we give intravenous arsenate, especially 2 point something grams in this IV. Okay. Let's go to the next question. A patient presents with a history of previous child with Down syndrome, currently on lithium. Again, this is the same question, Epstein anomaly. All right, the same OB-GYN question is given here. Epstein anomaly, हमने देखा है ना? ये देखा है ना? Then look at this. Hormone and endogenous substances that are involved in regulation of calcium. What is that? Tell me this. Hormone and endogenous substances that are involved in regulation. Okay, Dr. SF. Definitely there will be questions from this. It is not possible that we have made sure that all important questions are included. And today I told you, right, we will make sure to update it. We don't want, see, maximum the questions are fine. But the problem that happened was there were printing mistakes because we were doing it very fast. And due to the printing mistakes, you know, the answer is given as B or it is given as C. And because of that, there are people complaining. And yesterday somebody messaged Ashish sir ki, you know, आपको शोभा नहीं देता, giving us wrong things. And the thing is, we are not giving you wrong things. We are trying to give whatever possible. So please, we are really sorry if we upset you, but हमारी साइड भी देखो, देखो मेरी हालत देखो, तो थोड़ा हमारे ऊपर भी तरस खा लो. Okay. The answer to this is your vitamin D, PTH and calcitonin. Okay. बाकी का करा दोगे रितेश? मेरा रितेश will do the rest.
Which of the next question is which of the following drugs can be used for the treatment of undescended testis? In this, the answer would be GnRH. Examples of GnRH will be would be leuprolide. In this, we give the pulsatile GnRH in the undescended testis. In surgery, we have a question that if a child presents with the undescended testis, we generally go for laparoscopy to find it. And for the next question, after eating an unknown plant, a child presents to the emergency in comatose state. The pupils were dilated.
So in this question, right, in 25th question, why is it GnRH? Because there is undescended testis and two undescended testis. There are two questions that occur, especially ectopic testis and where is the undescended, you know, the proper undescended testis. So make sure you know the positions of the testis and also know that undescended we can give GnRH because it will descend it back to the scrotum. All right, it will descend it back to the scrotum. पटियाला शॉट ऑफ ओल्ड मॉन्क विथ हॉट वाटर. नहीं यार, तुम मुझे टपकाना चाहते हो क्या? अभी एग्जाम है ना. आई एम वर्किंग डे एंड नाइट. मे बी बिकॉज ऑफ दैट आई एम गेटिंग सिक. Okay, this question, look at this. After eating an unknown plant, a child presented to emergency in comatose stage. The pupils were dilated and skin was dry. Body temperature is raised. All these are signs of your datura poisoning. Okay? Datura poisoning, other name for datura poisoning, can you tell me? This happened due to datura, right? दक्ष एक दिन ना एग्जाम के बाद जरूर हार्मोन पिएंगे. Okay, tell me, datura poisoning. Yeah, atropine is the drug of choice for datura. Atropine is the drug of choice. Thank you, Wahab. Thank you so much. Thank you so much. Very good. Very good. So datura is the answer for this. And remember, the skin is dry, dilated. All these are symptoms. And this exam has come these questions have come many times in the exam. I'll send the PDF. I'll send the PDF. Then look at the next question. 27th, a farmer presented to the emergency with garlic odor. Garlic odor itself is a big point. And remember, pinpoint pupil. And what is the drug of choice? This is OP poisoning. And what happened? Yeah, railroad poisoning. What they do, datura, they mix it with the prasad and they give it to you as prasad on the rail. And you'll be like, अरे वाह, इतने प्यारे लोग हैं, प्रसाद खिला रहे हैं. And then you will eat it. और फिर क्या हो जाएगा? यानी तो आपका रेप हो जाएगा, या आप, you know, all your belongings will be gone. ठीक है? तो be very careful of people. People are crazy. All right? किसी पे भरोसा मत करो. Do not trust anyone. Yes. So look at this. This is OP poisoning. All the symptoms are given and the drug of choice is atropine. All right? Drug of choice is atropine. Now look at the next question. Look at the next question. An elderly male developed the symptoms of dementia and was diagnosed as Alzheimer's. Which neurotransmitters is reduced in this disease? Don't worry, everybody who's worried about my health, I will take care. But right now, your exam is more important and I had made a promise to you. And because I am Ashish sir's student, that promise will be taken care of. ठीक है? आशीष सर मेरे मेंटर है. आशीष सर कभी प्रॉमिस नहीं तोड़ते. तो मुझे कुछ भी हो जाओ, मैं मेरी प्रॉमिस खत्म करूंगी. ठीक है? Okay. The answer to this is acetylcholine. The answer to this is acetylcholine. That is what is the neurotransmitter. All right. Now look at this. Look at this question. The next one. An elderly patient presented with tremors, rigidity, and bradykinesia. The most likely neurotransmitter affected in the brain for this patient is. Now this is talking about Parkinson's disease, right? Parkinson's disease. And definitely this is dopamine. So one is acetylcholine, that is. Thank you so much. Good doctor. Thank you. Yes, very good, very good. Now look at the next question. Which of the following combination of seizure and its first line drug is not correct? Which of the following seizure and its this thing is not correct? So the answer to this is, he's Ritesh, you know him. He is the one who makes all clinical questions in our integrated learning channel. Okay. Drug of choice for Parkinson's disease. What is the drug of choice? You tell me. What is the drug of choice for Parkinson's disease? What is the drug of choice for Parkinson's disease? All these points are very important. Okay. Very good. Very good. Drug of choice for Parkinson's disease. Okay. And we will do forensic medicine later. Can we finish patho today? Can we finish patho today? Let's finish patho. And then I will update this PDF, and tomorrow onwards we'll have a proper session where I don't have to show you 2 slides. Okay. Look at the pathology questions. Okay. Yes, ropinirole and pramipexole. Very good. Donepezil is for Alzheimer's. Let me go to pathology. Now look at this. A 40-year, this again is your type 1 hypersensitivity. What did I tell you about type 1? B allergy, came to the emergency room with swelling. This is your type 1 hypersensitivity, and this is an anaphylactic shock. And what is the mediator, inflammatory mediator? That is definitely your histamine release from mast cells. We have discussed this before. Now look at this. What is the answer for this? What is the answer for this? Image is showing you spoon-shaped nails, right? Okay, very good. So what is the answer for this? We will finish patho. We will finish patho and then we can continue tomorrow. Okay. This is seen in iron deficiency anemia, and the cause is iron. See, now look at this question. What happened? The answer is correct. I wrote iron deficiency anemia here. The explanation is right. But what was the mistake? What was the mistake? Look at the mistake. The mistake was that here the answer, this was the typing error that was there. Okay. So for this question has been sent in the group so many times. So I always tell people to read the explanation, because most like explanation we make sure that they are right. Okay? So do you want to finish patho tomorrow? पर खत्म कर देते हैं ना 10 minutes. Or you want to wait? You want to do it tomorrow properly? क्योंकि patho I can explain better. So please, I will correct this. Okay, I will write the answer as A here. Okay, let's finish this here because we will be done with 3 subjects. Now look at this. When Congo red is visualized on polarized microscope, can you tell me something about this? Let's do this, finish in 10 minutes, then you can attend chanting. Okay? Let's finish this today. We'll continue. I want to finish it today. Amyloid. Okay, amyloid on Polaroid light, it is seen as apple green bipharyngeus is seen on Polaroid, and plus I wrote all the pigments which are important for you. Okay, very, very important. All of them are PYQs. All of them have come in the exam. Okay. So for calcium, we do von Cosa stain. For lipids, we do oil red, ya Sudan black. Okay. For melanin, we do Mason Fantona. Okay. So go through this, or go through all the things that I've written here. Samajh gaye? Now look at this. This question, I've discussed it many times. What is seen? There are hypersegmented neutrophils. Hypersegmented neutrophils are seen. They are a classical finding of vitamin B12 anemia caused due to vitamin B12 deficiency. Okay? So the answer to this is vitamin B12 deficiency. The answer to this is amyloid. Okay? Plus you also see ovalocytes here. Ovalocytes are seen here. Ovalocytes are seen here. Then look at this. A 65-year-old man presents with complaints of low back pains. On further evaluation, he is found to have electrophoresis, an increased level of IgG, he has elevated serum calcium and that does not match. Skull shows punched out lytic lesions. This is definitely pointing towards multiple myeloma. Now remember, there are 4 bodies in your multiple myeloma that are very, very important. Flame cells, Dutcher bodies, your Russell bodies, okay, and your Mott cells. The image here given here is of a Mott cells. Okay, what are Mott cells? Always remember, the cells will be having eccentric nucleus, eccentric, okay, eccentric nucleus, and here some finding is seen. So if this is reddish pink in color, they are known as flame cells, okay, they are known as flame cells. If there are fat globules here, if there are globules here like given in the image here, then it looks like a Mott cell, okay. Then you have Russell bodies, which are present in your cytoplasm, and your Dutcher bodies, which are present in the nucleus. Okay? Go through all the images, they have all been given. And this was also a PYQ, your Benz-Jones protein. Okay? Then look at this. A 35-year-old man presents with swelling around the right knee. X-ray shows soap bubble appearance. It is a finding of your giant cell tumor. Okay, it is a finding of your giant cell tumor. It is also known as osteoclastoma. Okay, one thing that they asked in AIM 2007 is, which are the tumor cells? Are these round giant cells the tumor cells? So these are not the tumor cells. The tumor cells are the ones which are in the periphery. All these small ones are the tumor cells. Okay, these are your tumor cells. Okay, got it? Now look at this. A 15-year-old male presented with progressive intra-abdominal mass and peripheral lymphadenopathy. He has night sweats, fever, weight loss of 8 kgs over the past 6 months. The biopsy taken from the lymph node and genetic analysis was performed, which shows presence of T14. Remember, this is Burkitt's lymphoma. Okay? And what kind of appearance is there in Burkitt's lymphoma? What kind of appearance is there in Burkitt's lymphoma? Also remember, it is associated with EBV. Okay, this was also PYQ, so I wrote it here. Very good, very good. Usually the image comes with starry sky appearance. Okay? Now look at this. A 30, not much to discuss here. This is orphan Annie nucleus. Orphan Annie nucleus. Look, there are no nucleuses. It is pale inside. The cells are pale inside, and they remind somebody of the cartoon, which was a female who did not have her pupils inside. Okay, so this is orphan Annie eye appearance, and they are seen in papillary carcinoma. Also, there is another appearance known as Samoma bodies. Very, very important. In medullary carcinoma, they will mention something about calcitonin, increased levels of calcitonin. And follicular carcinoma of thyroid will show you, definitely show you, capsule invasion. Capsule invasion. Okay? A picture of capsule invasion. Let's go to the next. This is a direct, simple one-liner. Supravital staining is done for your reticulocytes. Supravital staining is done for your reticulocytes. Okay. Thank you, Akhilesh Sharma. Thank you so much. Now look at this. Small or medium sterile vegetations seen with commonly associated with SLE patient. This is a very simple question. Remember, SLE. The keywords for this question are SLE or sterile. Anything related to that is pointing towards your limb mac endocarditis. Okay, limb mac sac endocarditis. All right. So very, very important. Sterile plus SLE, these things will always be present in limb and sac. ठीक है? बाकी के this explanation is very good for the rest. Okay, so go through them. Now look at this. A patient presents with, this is definitely mucormycosis. We have done this before. Okay. Now look at this. A teenage presents with features of liver disease, poor coordination, mass-like feces, psychiatric symptoms. Which of the following is implicated? Without even looking at the question itself, from this I know that they are talking about Wilson's disease, because most commonly they will ask a question on Wilson's disease, and the answer to this will be ATP7B gene on chromosome 13. Okay, ATP7B gene on chromosome 13. Anywhere a child is present, remember, close your eyes and mark acute lymphoblastic. If they give you a presentation, a clinical case of a child, then definitely they want to ask about ALL. Okay, they want to ask about AL. Got it? Got it? Now look at the next question. This again we did it. Cardboard is given. Cardboard is given. So this is definitely bagososis. This is definitely bagososis. A tall male teenager presented with gynecomastia. This is, we have done this before. This is pointing towards Klinefelter syndrome. This is pointing towards Klinefelter syndrome. These are clinical features of Klinefelter syndrome. Okay? Now look at the next question. A 16-year-old boy, abdominal discomfort on the left side. He went to the physician. Later developed some GI malignancy. On GI malignancy, this is seen. So more than 100 polyps. Can you see how many polyps are there? So more than 100 polyps is a feature of your familial adenomatous polyposis. Familial adenomatous polyposis. ठीक है? Familial and plus the things that have been said in this case are all really, yeah, APC gene defect. Very good. It has an APC gene defect. Very, very good. Very, very good. Now look at the next question. A 30-year-old male patient has a complaint of painless testicular mass. His blood sample revealed non-elevated alpha fetoproteins. Okay? This is pointing, whenever there is a painless testicular mass, they are definitely talking about seminoma. Okay? Testicular mass is there, painless. This is सर्जरी 8 को है, मैं छोड़ दूंगी आपको, अभी मैं छोड़ रही हूँ. There are a few questions only ना. Let's finish this, then you can go. Okay? 20, look at 20. A worker in the wheat section, again, this is telling about peanuts and it is caused by aflatoxin due to Aspergillus flavus. ठीक है? Aspergillus flavus. Then look at this. Which of the following is the most likely diagnosis with a lady with extremely low TSH and high T3, T4? High T3, T4. Definitely this is Graves' disease. ठीक है? This is Graves' disease. Definitely this is Graves' disease. Alright? And let's remember, in this question they asked about anti-TPO antibodies. So this is Hashimoto's thyroiditis. Also, your signet ring appearance is seen in invasive lobular cancer. These are all one-liners. Okay? And of course, xeroderma pigmentosa is a nucleotide excision repair defect. I will add any other points related to that. Okay, so we are done for today. One thing that I will tell you is that from 10:30, please give at 10:30. Please give the test that will be live on IL and NLC app. Okay, I'm sorry. I took the session fast. I'll do steaming and something and try to get better by tomorrow. But I'll make sure that there is good explanation in this. Okay, and I'll get this corrected and I'll send it to you as SAP. Okay, I love you guys. Please keep studying. NLC is always with you. Ashish sir is always with you, and since Ashish sir will not leave you, we will never. Okay, we are big bhakts of Ashishwar, so stay motivated. See, look at us. Even in any condition, we are working day and night for you people. So this should be your motivation to study more. Okay, so take care. We love you. 10:30 को 30 MCQs रहेंगे और till the day of your exam. Till 11th, we will have 30 MCQs every day on the app. Okay? Take care. I'll post the app details now. Okay? Take care then. Let me just finish the session. Take care. We love you. And अब की बार 150 पार. ठीक है? अब की बार 150 पार. All right? Let's go. Take care of yourself. All right?